95.7 WCRC. I apologize about that, but answering the phone because we are privileged once again to have Dr. Ryan Jennings from HSHS St. Anthony Hospital. He is the Chief Medical Officer there. Good morning, Ryan.
Hey, good morning, Gail. How are you?
I'm doing very well. How about yourself?
Well, I'm a little tired. I had a really long night and was up the majority of the night and doing something that had nothing to do with COVID, just good old-fashioned medicine.
Oh, my. Well, in one way, that was probably a bit of a relief, although you're probably pretty exhausted today.
It makes for a long day, but,
Yeah.
at least it's nice to still, realize it's kind of good and bad, even though we've been very consumed by all of this, all that other work that, goes on from day to day still continues in the background and maybe doesn't get as much attention as it deserves sometimes. So it was a good and a bad thing, but, hopefully all involved will do well, so.
Well, that's good. So how are things going whereas this pandemic is concerned? I know locally, so far, we've been pretty blessed.
We have. I think, the biggest thing in the region, of course, is the outbreak in Jasper County that I'm sure folks are aware of. Unfortunately, one of the long-term care facilities has been affected with an outbreak in the facility. And, as you recall, when this kind of thing really even began in the United States, that's one of the areas that they're very concerned about. And that's one of those ideas of congregated living, meaning people that, live in a collective environment and share the same air system and those things like that. So been working closely with those folks. I will say the home itself, the Jasper County Health Department, and actually the Illinois Department of Public Health has a specialized section of it that deals specifically with long-term care facility, public health specifically, and they've been exceptionally supportive. So, obviously a very concerning situation as that continues to evolve, and we'll see additional testing and things like that. But they were on it as quickly as you could be, and hopefully they'll do well. But certainly thoughts and prayers are with those families and those that are affected by it.
Absolutely, that would just be such a nightmare for the patients, the staff, the families. I mean, it's like ripples when you throw a huge old concrete block into the pond. So.
No, it's very true, and it's basically the impossibility of social distancing. So it kind of gets to the exact opposite of what we continue to hope that people are able to do, which is maintain that social distancing and stay home and not expose yourself to others, because it only takes one. And we've seen lots of scenarios where there were gatherings for a variety of reasons, and unfortunately somebody maybe was asymptomatic and was carrying it, and the next thing you know, you have people that are severely ill. So the urgency's not gone away around it, and of course, there's an awful lot of Jasper County folks that work in this area and all around, and so we want to keep a very close eye on things. Even though those folks are in the facility, there will be additional cases that are outside, and so now's not the time to lower our guard there.
Exactly. And I really appreciated one of the points that you stressed in one of our previous conversations, and that is, well, if you feel good, it's okay for you to get out and go wherever you want to go and do whatever you want to do. And that's not the case, because as you just mentioned, it could have been someone at a gathering who was already carrying the virus but was still asymptomatic.
Very real, and it seems like folks are carrying it for 3 or 4 days before they really develop significant symptoms, and so you're basically fine, and then in reality is that you're spreading it throughout the community unknowingly. So that's hopefully somewhere this again, the social distancing, the masking, those things are going to help us. So. And they have. I think we would have seen a whole lot more problems already. As much thoroughfare as we get through Effingham and, in the surrounding region, I think we would have seen more problems if people weren't doing such a good job at taking care of that.
Right. And I know a lot of people are wondering just how strict do you need to be when you have been out. Now, myself, I come in and take my clothes off and throw them in the washer immediately, and I've even been wearing shoes that are washable. But a lot of people are saying, oh, that's not necessary. What's your opinion on that, Ryan?
Well, it's a little tough call. I mean, I think some of it, it gets to the idea of if you're getting too close to folks, but maybe not of your own intent, it just happens.
Right.
And especially with the masking guidelines for people out in the community, the idea then is, again, to reduce the risk of surface contamination. So if they cough, sneeze, or just touching their, their face and mouth and things like that, that they don't contaminate surfaces. So I definitely think that, when you go to areas that are very challenging, like, the store when you have to, and you do have contact with folks, kind of almost no way to avoid it, going to that extreme makes sense. I think if you've simply gone out and done some exercise and walked on the trek trail and maintained good distances, then there shouldn't be any real risk there. So I think you just have to think about what you're doing in the community and continue to pay attention to not touching your face and mouth and those types of things when you're out in the community.
Right, and just basically use some common sense.
Yeah. Yep, and that hand washing goes a long way.
Oh my gosh, yeah, absolutely.
The only other thing, really, just a lot of gratitude to the community. We've seen, continued outpouring of support as we, continue to be ready and to assist those areas that are asking for our help. We've been able to help with supplies and things like that to the other regional hospitals that have been affected more heavily, and some within our own health system. I do have some good news, as we look kind of towards the west, because things kind of go west to east. It does seem like we're seeing a little bit of a downturn, but now then we've got this little local pickup, so it's going to kind of still be kind of hot for a while, and but hopefully we're getting closer as the weather warms up. We'll see continued improvement, and there is some thought that warm weather does slow the spread of the disease. So I think we're hopefully getting closer to being able to resume some normal activities.
Right. Just as long as everybody still, as we said, uses common sense, and people wash those hands.
Yep.
Wash those hands.
Yeah, and we continue to get a lot of questions about testing, and we're continuing to test folks that are symptomatic. There was a big blurb from the governor about not requiring a doctor's order, which is true, but that's a kind of almost a semantic thing, because that's just more of waiving the responsibility of somebody scribbling their name on the paper, usually illegibly. Done a few of those myself.
No.
But it doesn't get around the need that they're still testing symptomatic people, and the testing sites that are out on the website, basically 100% of them have some type of you need to go through your primary care physician first, or you need to go through a virtual care first, or you need there's a step there to make sure that they're still testing folks that are symptomatic or high risk because of their occupation.
Right, exactly. And Ryan, we appreciate you calling so much. Did we get everything covered you think that we need to cover today?
I think so. Like I said, I think the hot seat is really how things will evolve in Jasper County, and we'll see how it goes.
Right. So, folks, do not let your guard down. Keep up with the proper precautions, and everybody be safe.
That's right.
All right. Well, thank you so much, Ryan.
Thank you, Gail. Hey, have a great week, and thank you to WCRC.
Oh, you're very welcome.
Bye-bye.
Bye.